I want to take some time to explain to you what is direct primary care. And direct primary care at a fundamental level is a change of the business of medicine. That's all it really is. We are fundamentally changing the business and the pricing structure of how the business is run. Now, why is that important? It's important because the business of medicine is what has led us to many of the problems that are prevalent and rampant in the current marketplace of medicine. And to illustrate how that works, most traditional medical practices right now, they accept insurance and they follow what's known as the fee-for-service system. And the fee-for-service system is exactly what it sounds like. It's when a patient comes in the door, they have a complaint, and there is a fee associated with the visit, but then there's also itemized charges based on what is done during the visit. So if you got stitches, if you got a biopsy, if you got labs done, all of those kinds of things, they all have additional charges. Now, the key part of the fee-for-service system is this is how practices get their revenue. And it includes all of the overhead and markup and staff salaries. It includes the doctor's salary. It includes the power bill and the water bill and all kinds of things that are associated with running a successful practice are all built into the fees that are charged to you, the patient. The problem with that is you look at health insurance, the premiums are going up, the deductibles are going up. It's outrageously expensive to get any kind of care. And even as a provider actually running the practice, it's not getting any cheaper to run a practice. It costs money to see a patient, to provide care, to provide treatment, and all the insurances want to do is to pay us less. Well, what happens when you do that? We're required to see more and more patients in a day. And at this point, the average traditional medical practice is required to see somewhere between 2,000 to 3,000 patients on their panel. That means seeing 25 to 30 patients in a day. And if you have ever been to a regular practice, you know that it's really hard to get in with them. You usually don't hear back for weeks. When you do get in to see your doctor, it's a 10-minute visit, a 15-minute visit, most. You can only talk about one, maybe two problems at the max, and then they're telling you to follow up. They don't have time. They have too many patients. There's too many responsibilities to deal with. And how do we fix that? Direct primary care works by separating the business of medicine, which is what got us into the problems that traditional medical practices have, from the actual practice of medicine. We have one monthly retainer fee, which covers my salary, it covers the overhead, it includes all of the markups that I would traditionally charge a patient for, and then we can just have a normal visit. Patients can come in whenever they want, as much as they want. It's much like a gym membership as opposed to a constantly trying to milk you dry for everything that you have. You can come in whenever you want. I've had patients come in 12 times in a month for 90 minutes at a time. We've done procedures and injections and stitches and biopsies. I had one patient come in and see me for over 2.5 hours, and the only charge that they got was for a biopsy send out that was about $20. That would have been a $700, $800 visit if I would have billed their insurance. And when you don't have to do that, when you can change the business of medicine, the actual medical care that you deliver gets better quality, it's more affordable, it's faster to access. There are so many things that we can do in direct primary care that you can't do in a traditional medical practice. And if you want to learn more, I would be happy to discuss it with you. Please feel free to schedule a consultation. I'm Jason with Starlight Health. You have a wonderful day.